guides, no, do you think it sort of improves your sexual life?
Okay. I don't think I'm getting the second part of the question too
Okay,
well.
so I'm asking if the first question is, do you think that gynecologists are available to a lot of people in terms of accessibility, going to them to ask about what's happening down there? And do you think it improves your sexual life if you do have access to them?
All right. Now, generally in Ghana, our doctor to patient ratio is poor. We do
Mhm.
not have enough doctors
Okay.
to see the patients. Now, to talk about specialized doctors,
Okay.
they are even fewer. So, yes, accessibility may not be as much as we would like it, but they are there. And then the general doctors also deal with such conditions. So, yes, like what you said, accessibility may not be that good, but they are there.
Mhm.
Now, the second thing is having an encounter with the gynecologist. Does that improve your sexual health,
Mhm.
sexual knowledge? I believe so. In more developed countries, by the time a girl child is 21 years, she's had HPV vaccination. She's done certain routine checks with a gynecologist and all of that. So it makes them equipped, it makes them knowledgeable, and they know what to do, what not to do. And it's even incorporated in their school system. They have people come into school to educate them, gynecologists, other sexual reproductive health specialists coming to talk to them. So yes, having that encounter, without having that encounter in a safe space without bias, knowing that this is a doctor. If I talk to them, it will not go and get to my mother, it will not go and get to my father. You can ask all your questions, it will equip you. And if you have any problems too, you will be able to solve them. So I think that's one thing, that's one major challenge that is general across the country. But I think in university settings, it's a bit better because you have your university clinics that are judgment free. So you listen, they don't judge. So you can talk to them and then
Mm.
get the help you need.
I mean, I'll pick on that last point, but we are live on Facebook and we're live on YouTube as well. So if you're listening to us, welcome. And we're talking about sex life at University Summit with Dr. Erica. And Dr. Erica, let's talk about, we listened on trends. Let's talk about that. I've had this problem over the week where most of the counselors who have come in have spoken at ease to some of these things. For example, yesterday we were talking about personal hygiene with some basic things that you would expect personal hygiene, and then people are not doing it. And I honestly feel like it's because they were not exposed to it. It's not because the knowledge isn't common sense. Do we think sexual health is difficult, or we think it's easy? Do we think it's something that's basic
Okay, are you talking about sexual health knowledge?
knowledge,
Okay,
sexual health knowledge?
we live in a very cultural and religious society.
Right.
So a lot of these sexual health topics are taboo. You can't talk about it to your mother, to your big sister, to your friend, in your church group. You'll be seen as a sinner. So it's something that I understand. It's not easy to get the knowledge, to receive the knowledge. But then I think that in our current landscape, it's not as difficult because Google is our friend. You have a thought in your head, you Google it, and then you have WebMD, you have all these accredited sources that you can learn from. So yes, I would say that in our part of the world, having sexual knowledge or having knowledge about your sexual health from the people around you is almost impossible. There are a lot of us who grew up without anyone telling you certain things. You discover it on the way. You pick up good and bad, and then you shape your life with it. You pick up good and bad. I think that right now would be less difficult to say that, or right now you will not be able to say that that knowledge isn't easy access, 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 that that
We are good people. We are generous people here. So everybody has a good set of gifts waiting under their chairs. I'm not going to disclose what the gifts are because we don't want to get cancelled. No, I'm just kidding. But then everybody gets a condom, and we're trying to preach safe sex. And so please use it wisely. We are hoping that after or before we end, Dr. Amanda comes on to show us the appropriate ways of using condoms. Right, straight into the studio. Anybody with a question? So we go straight ahead and ask. Okay, the girl in the glasses.
Interestingly, people think that birth control is expensive, but it's very cheap. It's highly subsidized by the government, there are international organizations, and all that. So birth control is very cheap, very affordable, as low as 5 cities, 10 cities. You can get the pill, you can get the implant, you can get the depot, the injection that they inject every 3 months. You can get an IUD. It's very cheap. You can get some at any government hospital that has a family planning unit. And then there are other, am I allowed to mention names of
You are.
organizations? All right. So there are organizations like Marie Stopes.
Mm-hmm.
You would find Marie Stopes almost everywhere in Accra.
Mm-hmm.
There's PPAG as well. So government organizations, government hospitals with family planning centers, Marie Stopes, PPAG, you wouldn't spend more than 20 cedis on getting an appropriate contraceptive method. So it's very affordable.
Very.
Very, very affordable.
Mm.
Right. Still on the topic of contraceptives, you mentioned the pill and other stuff. These are all types of hormonal contraceptives, and I know these contraceptives have side effects. What are these side effects, and if someone gets them, how do they manage them?
All right. Now, some of these side effects, I always say that with medication, you have to look at it's a cost benefit analysis. You have to look at the benefit that you're getting from it, and you have to look at what it's costing you and to see if it is worth it. So, with a lot of these hormonal contraceptives, you would experience some spotting, you may have some breast tenderness, and I know what worries most people is the weight gain, you know. Yes. So with all these things, you have to look at it. You have to see the benefit that you're getting from it. But if you are very troubled by it, you are bleeding a lot or having some prolonged bleeding, irregular menses, spotting in a way that you do not like, you can go back to where you got the family planning method from, or go back to any obstetrician gynecologist, any hospital, and let them know that you are on this product, this is what it's doing to you, and you want to stop it, or you want some medication to help you with the side effects, and that would be done. But I know a lot of people's issue is either the weight gain or the bleeding. And unfortunately, that is in almost all of the hormonal contraceptives.
Hi, so I know people that had consented to having sex with people, but afterwards felt confused or guilty. So I wanted to know if it was normal to feel that after having sex.
Ooh. All right. I think the decision to be sexually active is a personal one, and you have to be sure before you make that decision. So, as I said earlier, we preach abstinence. We advise that if you are very young, you try to delay your sexual debut. You should try and delay the age at which you're having sex. But then, if fortunately or unfortunately you actually do have sex, you have to think about it properly. You have to think about the person that you're sleeping with. You have to think about the place. You have to think about the timing. You have to think about the possibilities of pregnancy. You have to think about all those things. So it is not unusual for a young lady unmarried in school with parental support being conflicted after having sex, right? But you have to think about it properly before going into it, because it's not just a pleasurable activity. It's an activity that can leave you with a lifelong burden. If you're not even talking about children, it can leave you with diseases and all of that. But another thing I like to say is that you feeling conflicted after having it, you gave consent and all that, you feeling conflicted after is not grounds to say that you were raped or anything like that, because that's a lot of stories that we've been hearing. So being conflicted after is a personal thing. Maybe next time you wouldn't do it, or next time you wouldn't do it with that person. It's up to you to make the change. But it will also be very unfair that because of your confliction, you will change the scenario. So please, that's my answer.
Okay, so my question is very simple. So it goes this way. What should an individual do to prevent or protect him or herself from infections or pregnancy immediately after having sex?
Thank you for your question.
I
Yeah.
actually had an experience, so I would love to
Okay.
hear from you, and I also give you what I did or what I went through.
All right. After having sex, especially for ladies, you are more prone to having UTIs or to having certain vaginal infections. Or even if you have a yeast infection and you've treated it, it can just trigger it again. Okay. So after sexual intercourse, we recommend that a lot of ladies know you get to the washroom, you go and pee, and then if you can just quickly wash yourself with unscented soap or just water, nothing too strong, none of those powders, tighteners, douches. inserting things. No, all those things, they are all, so just that. And then you can go back to do whatever you want to do. So it's just very simple. For the meals to just a simple cleanup. None of those fancy things that are always being advertised. Interestingly, they are advertised for that purpose, but they even make whatever it is worse, because if they have scented products, some of them are very, very chafing and toxic to the vaginal probiotic area and all that. For meals, just a simple cleanup. And I think that will go a long way. So I'm waiting for your experience.
All right. All right. It was a friend of mine I visited. Actually, I didn't have any intention of we having anything to do that day. But unfortunately, it happened.
Okay.
So,
unfortunately.
Yeah.
Okay.
So, I went home without having anything in mind. When I went to my bath, I took my bath, then I was off. But the next day, I was thinking about it because it was actually unprotected. So, I called the girl. I asked her how she was doing. She was like, she's fine. But I think that was her first time actually. So she was afraid. So 2 days later, I called her again. Then I asked her how she was doing. She was like, yeah, she's fine. But she later on told me that she has to talk to someone because she was afraid of whatever happened. So that she went to a friend. Then she was like, if you have a sex, like she actually kept the story in a way that is not tailored towards her. Then she got an answer. So what she told me was that friend advised her to actually take a pill, which she did. And I think that resulted in her not getting pregnant. With that, so I think as well, I asked her how her period went. Then she was like, yeah, it came true, but it didn't come normal as it used to come. So I was thanking God because
well, I think well, you're not a bad looking man. You'd have made a good father if that if that was the criteria. But I mean, we're preaching abstinence. Well, are we preaching abstinence? Are we preaching
safe sex?
We are preaching safe sex.
All of it.
Okay, but no, what do you have to say for that? Because you did mention the blood flow change. Is that a side effect thing?
Okay, so I think that then I didn't get your question well. The question I got was more about infections and how to take care of yourself after sex because of that. Now, if you're talking about using the emergency contraceptive pill, yes, it is for emergency situations like that. Things that you didn't plan and they've happened, or things that you didn't protect yourself and then you had sexual intercourse. So you're protecting yourself now against pregnancy, but it doesn't protect you against any infections. That's number one. Number two, the emergency contraceptive pills, research has shown that it doesn't really alter. You said the period didn't come the way it comes, as in the number of days or maybe the flow. It's not supposed to do that. It doesn't really do that. But another thing is that people use it so many times during a cycle, so it may distort the cycle a bit. But the emergency contraceptive pill is for emergencies. Like your situation, it was an emergency. Yes, but you can't be having emergencies every day. Yes, so.
Now, sorry, before we move to the next question, I also have a question from sorry. So you see, the emergency contraceptive, what if the person finds out they're like 2 months forward in terms of pregnancy? Are they going to take those pills?
I don't understand.
You know how Uncle here he was probably fasting that the child, or there's no conception. In the case where the person, the girl thinks everything is normal, and after 2 months she feels, she goes to check, or she just has the feeling that she's pregnant, she goes to check, and she's pregnant. What does she take?
Folic acid. Yes, so she should start her prenatal vitamins and then make sure that baby grows nicely. But we don't yes. Well, I said I don't want to be cancelled. Well, if we
you know what, maybe we'll give the reply after.
Okay, if it's there are, in Ghana's laws, there are reasons why a person can end a pregnancy.
Okay.
We'll not go into that so much. There are reasons why. But to do it in a safe manner, you have to do it in a registered or an accredited facility
Mm-hmm.
with accredited personnel.
Okay.
Okay, so if you're conflicted about things like that, don't make a decision on your own. Go into any, as I said, any government facility with a family planning clinic or any of these facilities that I've mentioned earlier. You can have a conversation with them and see what to do. Okay, I think I've been very political.
Right, so we can go on with the questions. Anyone on the back have a question? Okay, we've moved to this side. Now let's ask.
Okay, so concerning the question, the also on the topic on contraceptives, is it safe to have sex after taking an abortion pill? Like immediately after?
Immediately after,
Yes, after taking an abortion pill.
hey, immediately after you take an abortion pill. So this is the reality. You are pregnant. You've taken a pill to terminate the pregnancy. You are going to be bleeding. You are going to be cramping. You're going to be in a lot of pain, emotional and mental distress that I don't think you'll be able to have sex immediately after. Unless you are some kind of super woman. I
Pray.
don't think it's not, I don't think you can. But I understand your question in the sense that after terminating a pregnancy, first of all, it's physically, it is painful. Mentally and emotionally, it's something that I don't think anybody wants to go through. Anybody is happy doing. Religiously and spiritually, it puts you all in a mess, right? So if this has happened to you, everybody makes mistakes and you've done that. I wouldn't recommend that. But if you've done that, I think the next best step is to protect yourself so that such a thing will not happen again. It may sound some way, but I've had patients who have had 9 abortions, 10 abortions. I don't know why you put yourself through all of that. We don't even recommend one. But if one has happened, you should try your best to prevent any of the others going on. Okay. So if after that experience, you see yourself and you would still be sexually active, do well to protect yourself. Do well to get on a regular family planning method, or do well to stick to, if you're using a barrier method like a condom, do well to stick to it. Because apart from all these factors that I've mentioned and how it can upset you, even physically, okay, if it's not done properly, can lead to some long-term effects with your fertility and all that. So yes, abortion is a very, very dicey topic in Ghana, but if it is done, I think that it shouldn't be done the second time. You should find a way to prevent it. And if you must do it, I don't recommend, but if you must do it, go to a proper place, because there's no point in losing your life over something like that.
Okay.
Is it true peeing or douching right after sex can prevent pregnancy?
No, it's not true. It is not true. So the sperm, so in the semen, the sperm swim. So after sex, you feel like you've gone to clean or you've gone to remove all the fluid. But then the thing itself is swimming and has gone somewhere else before you even went to pee or do anything. Right? So it's not a contraceptive method at all.
Please, my name is Henry, and I want to ask this question.
Okay.
So, if I am not married, and let's say if a female is not married and she doesn't want to get pregnant, what is the safest and the most reliable method of contraception for someone like my age,
How
let's say
old are
20
you
years?
then? 20. Okay. All right. At 20, safest, most reliable method to not get pregnant is to not have sex. Am I lying? Yes. That's it. But then, if you must, if you have to, if you will, I think that you should go and seek proper family planning counseling. Okay. People think that they are not available, they are not accessible, and people think that they'll be judged. But it's not like that anymore. I see a lot of young people. Let me give an example. I saw a young girl who was in SHS. So she came in, she was in SHS, she got pregnant, and she had a miscarriage. She came in and we helped her out. After that, she's going back to school to write exams. And I was like, oh, okay. So when you come back from school, should we put you on a family planning method? Or when you go to school, you would still need it? Because I felt like exam time there, you'll be very busy learning. She was like, oh, no, doc, do it. Give me the family planning before I go to school. When I go to... Yes. So who would judge you? Nobody would judge you. okay, if you were my daughter, that's not what I want you to do. But protecting you from these unwanted pregnancies is very important than you coming in pregnant at a very young age and having complications, losing your life, messing up your future and all that. So these facilities are available. You are in Accra, they are accessible. Any government hospital that has a family planning unit, so Rage, Kolebu 37, Achimota Hospital, all these places, almost all the government hospitals around, or you can go to Marie Stopes, you can go to PPAG, they have family planning services available. So you talk to them and you find out the one that best suits you. If you want one that's long term, you want a short term one, you want an injection, you want an implant, you want an IUD, anything that you want, you discuss, it will be done for you, and it's affordable.
So before we move to the next question, I have a question. You know, one thing I'm excited, or I've been excited about for the entire health week, is that we've had a lot of young health professionals come in, and they've actively made mention of how easy it is to approach some of these health workers. And I remember sharing with one of my friends yesterday that I think it's because now the health workers that are coming up are younger. I mean, you were the youngest person. You're still looking very young.
Thank you.
The thing is, I think there's a notion that when you're approaching somebody who looks like an auntie, you know the reply is going to be like an auntie's reply. But if I was approaching you every day with things I was going to do, I wouldn't mind the reply that comes after. So what is the assurance that a lot of people are not going to, well, I mean, it's a good thing. Maybe it's a good thing, it's a bad thing, because older people might lose their jobs. But what is the assurance that the young people would want to go to the old people for advice?
All right. I think if you go into a health facility and your question is you meet an older person, how sure are you that they are going to be as friendly or as open-minded to you? And I would say that it's a professional setting. We are no longer in the past where the opinion of the practitioner matters so much. Right now, my opinion doesn't matter. This young girl in SHS who was going to school, going to write WASI, and told me she really needs the family planning. She really, really, really needs it all before she goes to write her WASI. I'm looking at her like, hey, science student, you really need, but my opinion does not matter. So we are in that era. It doesn't matter the age. Once you come in, my opinion doesn't matter. It's what you want, how we can discuss it, how we can do it in a safe manner. Now, I understand you, because maybe if you are in the districts or in the more rural communities, in some of the villages, where it's a community living, it's a community setting, the midwife or the doctor is your mother's prayer partner. So when you discuss something with her, even if she will not go and tell your mother in prayer, she'll say, let's pray against our children being promiscuous. So I understand that. But luckily for you, you're in Accra, you're in a city, and I would bet you that you wouldn't have that experience. And even if you do, you have the right to report the person to whichever authorities, because your opinion or your personal private opinion doesn't matter. It's just your professional opinion. So you meet someone who is in their 50s, you meet someone. My father is a doctor, he's in women's health, and he's my father, so he's grown, right? But I see him having certain chats or conversations with young people, certain ages. You can see the sort of counseling that's given. I know that he doesn't want that for me, but his personal opinion as a parent, it doesn't matter. It's what is in the best interest of the person, because you can't stop someone from doing what they truly want to do.
That's right.
They will do it. So you just have to protect the person so that the outcomes are not too bad. Yes.
Okay. So we'll take a final question and we'll go for another commercial break. So then there's a free flow of questions. So, Carol.
So I have this friend who's pretty sexually active. When I say pretty, I mean pretty sexually active.
But how would you know that? No, go ahead.
Because I know the person.
Okay.
She wanted me to ask this question about what is the safest way to have sex when she's not trying to get pregnant?
Okay. The safest way to have sex when you're not trying to get pregnant. Now, we are talking about safe in terms of pregnancy, not safe in terms of diseases, sexually transmitted diseases. So safe in terms of pregnancy is to be on a regular contraceptive method, okay? A regular one, a short-acting one, a long-acting one, or a hormonal one. So as I said, going to a facility and getting yourself on a regular contraceptive method, if she's pretty sexually active, like you're saying, is the best for her, because condoms fail, condoms break. Even the regular contraceptives that we are seeing, they may fail, but some of them are 99% effective, some of them are 97 and all that. So you have a higher chance of protecting yourself against pregnancy. And I think that for someone who that is what she wants to do, she has to also go and get the appropriate protection, else she will continuously get pregnant or be terminating, and we don't recommend any of these things.
Right. So we'll be coming back, and we'll be taking a few more questions. We just want Dr. Erica to take a breather, then we'll be back so that we don't jump on here with our questions, because now that we know we have a few people with sexually active friends, we do not want to hold them by the neck. But we'll be back shortly from this intermission.
Today we are here to look for talents. And
Yeah, I think we turned it off. Dr. Amanda, can we get the AC back on, please?
Amefiole, Miseliani, Shinshida, Ahanuno, Keha Klamanye, Kewebi, Le, Ekechababa, Le Ewa, Nakeke, Niwana Minshe, Eku.
a number of CVs which we took. We're looking forward to working with them.
The most impressive candidate I've seen today was a master's student from ACity. She was doing a master's in data analytics, and she's built models on cost management, on income prediction, and it was very innovative to see how she was applying what she was learning in school. And because we're also looking at advancing our company and looking at how these models can play an important role in the industry, it was interesting to see that ACity has slots like that for students to grow and then explore their passion. So that's the most interesting person I came across today.
I think last year we had a couple of them coming into Pelisol, Ghana. One person I can pinpoint who stood out for me is Christian. I think Christian had to be with us for a while, I think 2 months, for which we had to even ask him to stay on for another month. And 3 things stood out for me with Christian: someone who knows what he really wants in the business. And he's someone who was very committed to the task that is being assigned to him. Not just that, but also he had a hunger to do more stuff in the business. So that stood out for me when it comes to Christian. And I see that more with the ACity students who happen to be with us, very committed to the task they were doing and very apt to it.
The fair has been engaging and exciting. A key takeaway from this career is that networking is good, and making more connections will build a bigger future for you.
My experience at the career fair was very engaging. It was quite fun. So going to the career workshop this semester has really helped.
to call my own. Me and I make now I found someone to sit on my throne. Me friend no him man, no so from me or him. I don't be me to be honest you. Oh yeah, me mau be janga me yet yeah. Engo si se po beda santi me mudie. Otumasie no wale be when them near senia me no. When them near senia me no. When them near senia me no. Me baby answer me better don't go, me better don't go. It's you me more, me yo bia, me yo bia. Me baby answer me better don't go, me better don't go. I don't you don't see me. Me baby answer me better don't go. Say what I am more. Me yo bia. Me baby answer me better don't go. Otumbo see me don't see no bia. Me baby answer me better don't go. Say what I am more. Me yo bia. Me baby answer me better don't go, me better don't go. Oh, I don't you they don't see you bia. 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 I don't you
I can't hear you. I can't hear you. I can't hear you. Which camera are we looking into? Okay. Then how about doctor? Okay. So you can look into the lower one. Or they said we should look into both. Okay. 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 So that's for the crowd and that's for the world. Please count me in. Miss Dromo, how are you doing? Oh, Ipam, say hi to Miss Dromo. You want to go on there? Okay. All right, so we're back in the studio, and we've had some amazing, amazing questions coming in. We've sent a link out, and we're hoping to get a few more questions come in. But we're going to be asking the people in house to share their questions as well. So we are not wasting any more time. Anyone with a question can raise their hand, and we go. Okay, okay, go ahead, Jessica.
Hello, Dr. Erica. Thank you for coming.
Thank
You said something earlier that I want to pick on. You said the decision to be sexually active is a personal one, but it can also be guided by peer pressure and certain trends that are happening nowadays. So my question is, how does one know, how can one be sure that the decision that they decided to make is not because other people are doing it and it's something that they are sure of, or it's something that they're sure they want to undertake? Because social media is really influencing a lot of things around us. Even when we don't notice it, we realize that most of the things we say, most of the things we do are guided by what we see on social media. And you also stated that there are lots of people on social media who are just saying things for views, saying things that do not even carry any relevance, but because they want to be popular. It doesn't even have to be medically correct. They just say anything and it's believed. So how can one be sure that the decision to be sexually active is something that they want to do and it's not peer pressure?
This is a very deep question. All right. The decision to be sexually active as a young lady or as a young girl in school, it has to be guided by several things. First of all, religion. If you're a Christian, What does your religion say? Okay. Secondly, your family values. How would your parents relate to this? How are they going to think about it? Now, in the culture that we are in, what are the cultural values surrounding this? And then lastly, the responsibility of sex. Are you capable? Are you ready for those responsibilities? Now, thinking about it in that dimension should be able to help you to make the decision that, do I want to go ahead with this? Would I not do this? Because how would your spirit feel after this? If your parents find out, how is it going to be like? If you should get pregnant, are you ready to be able to bear that responsibility? Infections, all of that. And then lastly, who are you having this intercourse with? Who is the person? How responsible are they? How committed are they? How serious are they to not break your heart after all these things? Because a lot of girls go through a lot of psychological trauma after when they're very young, and then they have sexual intercourse and the relationships do not go the way they want. So social media is there. Social media is a big influence. But with something like this, I would say that know yourself first. Okay. As a young lady, know yourself, know what you are capable of, and know what responsibilities that you are capable of carrying. For me, I went to medical school very young, 16. Even at the age I finished, I was still a bit young. Knowing myself, knowing my religion, knowing where I'm coming from, knowing where I want to go to, and I know that I'm a baby girl too, right? So am I this kind of responsibility with its complications? Can I carry it? The answer to me was no. And I think I went to school around the same time as you are all going to school. Social media was still there. The influence was still there and all that. But I'll say that it's a deeply personal decision, because are you able to carry the responsibility of it? And who are you even having this intercourse with? If pregnancy ensues, how are you going to go around it? People think abortions are simple. It is not. People lose their mind, people lose their lives, people lose their wombs, people bleed, so many complications. And aside that, too, emotionally, you should know that as a young lady, once you get attached to a young gentleman emotionally through sexual intercourse, a lot of men don't see sex as a big deal. For them, it's a physical interaction. But as a young lady, once you get attached to this person this way, and then their mood changes, they switch a bit, how are you going to be able to handle it? Okay, so this question, yes, I know that social media has its influences, but know yourself. Know what you're able to carry. Know if you are responsible enough to be able to deal with the complications that may ensue. Know where you are coming from. Some people are coming from homes that even if they get pregnant today and they deliver today, their education, all of that will not be cut. They'll be living a perfect life, more perfect than someone who has struggled and learned and has received so many awards. Know where you're coming from. If that's not the kind of home you're coming from and you have to push yourself, know that all these things are not necessary. I went to KNUST last 2 weeks and it was a similar question. And my answer to that, or my baseline to that, is that you're in school. The main purpose of being in school is to get a degree. Get your degree and go. Okay, all these other things are side issues, but you're in school. Get your degree. If in getting your degree you can successfully add your side issues, that's up to you. But do not lose sight of it, that in school you're there to get your degree, get it, and then go. If you're able to handle all these kind of things, you are capable, that's up to you. But if you're not, don't let social media be a point or a factor. That social media person will not help you buy Pampers, will not help you treat your infections, will not help you with your broken heart after you notice that guy is texting another girl in your class. Okay, so all these things, think about it, know yourself, and then make decisions based on that, not based on anybody else. I think that's my long answer.
Do you have experience? Because you did mention, you said something, Pao.
What did I say?
When you said you'll be texting a girl in your class, has anybody done something to you before?
No.
Okay.
No.
Okay.
No.
Not me.
The song is that even your boo gets a boo, so you shouldn't be surprised
Okay.
if such a thing happens and you are so invested. Because young girls become very invested because of sex. You are so invested. I know people who have stopped school. I know people who have started antidepressant medication and all that. So know what you are capable of. Some people are hard. If you are hard, do what you like. But know what you are capable of and know that you are here to get a degree. Every other thing is secondary. And don't let social media pressure you that much, because they wouldn't be there to help you with the consequences.
Okay, any more questions?
Big
Okay.
sister advice.
Hello, Dr. Erika. Please,
Hi.
good morning.
Good morning.
I have two questions. So my first question is it normal to feel pain or discomfort during sex? And if not, what would you advise you do or the victim does? And secondly, could you please give in-depth details as to how and when contraceptives must be used? Because I had a friend who was like, oh, every 30 minutes before sex, she would always take contraceptives. And I'm not exactly sure how true that is.
Okay. The first question of pain during sex. So there's some level of discomfort during initial sexual activities, but pain during sex has to be investigated. So go to the hospital. Okay, go and see a doctor. Let them find out why you are having this pain, and then let them help you out. It may be nothing, it may be something. Now, the second thing of contraceptives, I think that we are using the word contraceptive loosely. I believe we are talking about emergency pills. Are you talking about the emergency pill?
She said contraceptives.
Contraceptives, okay. So if it's the emergency pill, it's for emergencies. That 30 minutes before sex, I don't understand it. But if it's a regular contraceptive pill, okay, that one you're asked to take it daily, at a particular time daily for its effective use. So if you take it every 8 a.m. or every 8 to 10 a.m., Monday to Sunday, you repeat it every day, you're supposed to take it for it to work properly. So this 30 minutes before sex, the only contraceptives that are swallowed are the emergency contraceptive pills or your daily contraceptive pills that you take. And the concept of 30 minutes before sex, I don't understand it. It's very wrong. And she's been taught wrong. Okay, so you should educate your friend that she should go to a family planning clinic, let them educate her on how to take her contraceptive pills properly. If it's the daily pill, you take it every day at the same time. Of course, a lot of people will not be able to take it at the same time every day, but you take it every day around the same time. If it's the emergency contraceptive pill, it is for emergency use. Your friend explained his emergency, so in situations like that. Okay, but 30 minutes before each sexual intercourse, she thinks that that's going to kill the sperms well. No, there's nothing like that.
Do you have any more questions? Yeah.
Okay. So on the topic of oral sex, I have a question that says, can you get an STI if you are practicing oral sex? And then I have follow-up questions on STIs and STDs. The first one is, how often should you check for STIs if you are sexually active? And are there some STIs that show up late?
All right. The first question, please. I think I missed out on that. The first question.
I think she was asking.
The oral sex, can you get STIs?
Oh, yes. You can get STIs from oral sex. Anything that has to do with exchange of body fluids, you can exchange infections as well. So putting your oral cavities in someone's genital cavities, just imagine. Okay, you can pick up a lot of things from that. Now, how often you should check for STIs? I think that at least yearly you should run a routine. If you're sexually active, at least yearly you should run a routine STI check. But now the question is, how sexually active are you and what is your sexual activity? If it's with one partner and that's one partner to you are his only partner, you can decide to do your yearly checks. But then if you have multiple partners, think every 3 to 6 months, just try and check what is going on. But it's advised that once you change a partner, you should check yourself and check that partner before you commence anything. And yes, some of these STIs show up late, and some of them you may not even have any overt signs and symptoms. Okay, so it's always better to be getting checked.
Before we move to the next question, are there any self-test kits for STIs? I'm only asking this because sometimes, our friend shared here, it's not expected. You go to the person's house, you're talking, and then it leads to something else. Maybe there's a test kit that is in my pocket that I'll say,
So
what?
you test before.
Yes, before you. Then I'm only asking because I don't think people have the time of carrying their I can't say spouses, their
partners.
I don't want to say partners as well.
Oh, why?
People don't have time of carrying their indulgences into the clinics to check. And sometimes the fear of you'll be moving. Today, didn't you come here with another girl yesterday and all those things? So are there other ways to check?
Yeah, so we have self-test kits, especially for HIV. The HIV self-test kits are available at a lot of pharmacies. And recently, I saw that there's a combined HIV and syphilis test kit as
Oh.
well. So you just prick yourself, put it in, and then you'll be able to know.
Mm.
But most of the other tests are blood-based in the labs.
Oh.
But I mean, the one we are most scared of, everybody's run away from, is
HIV,
HIV.
yeah.
So we have, and there's also one for hepatitis B as well. The
Okay.
quick rapid
Okay.
test kit.
Well, that's good. So
Yeah.
then, now, thank God for technology and advancement in tech. Yes.
My question is on the emergency pill. Now, I know someone who takes an emergency pill immediately after sex all the time. And I also know that from what I know is that the emergency pill is supposed to be taken not more than a particular amount of times in a year. Can you explain or?
All right. Taking the emergency pill after every sexual intercourse, it defeats the purpose. You are no longer having emergencies. You are planning your emergencies and then you are taking the pill. So we wouldn't recommend that. We recommend that you go and then get on a regular family planning method if that's what you would do. They have the daily combined oral contraceptive pills. You can do that. Now, taking the pill several times within one cycle. So as when we know our cycles, right, from the start of your period to the start of the other period. Taking it several times within one cycle reduces its effectiveness. So you find out that you took it once, you took it a second time within the same cycle, and now you are pregnant. You say it failed. No, you're not supposed to take it so many times within one cycle because the concept of it is to prevent ovulation. All right. And then you spoke about something lastly, and that you're not supposed to take it a certain number of times within a year. That's what people say, but there isn't any literature to back it. Okay, people say it to discourage abuse of it, and I agree, don't abuse it. But there isn't any literature to back it that if you take it more than 5 to 7 times, you take it more than 7 times in a year, something will happen to you. It's just not recommended because it will fail. And when it fails, you will blame it and blame us.
Okay. Any more questions? Okay, go ahead. Can we get a mic for him?
All right, so my second question is that is the pull-out method ever safe, or is it just a myth?
It's not safe. I was telling Amanda that I had a patient recently, and we were offering her a contraceptive method. And she's like, oh, no, she doesn't need it. Her husband knows how to pull out. She has 5 children. So is it safe? It is not safe. Okay. If you don't mind, like she's married. Her husband takes care of her. She doesn't mind. She says he knows how to pull out, but she has 5 children. She's taking care of them. She doesn't mind. It's not harming her. So she can do what she wants. I don't recommend it. But as a young person in school, you have your education. You can't take care of a child. You don't have money. The guy is your classmate. He's not working. What his parents give him. I mean, please don't entertain that. Okay. So it's not safe. It's not at all. And what you think you're pulling out, someone's already gone inside.
Okay. Okay. Hello.
Hi.
Okay, so my question is on the myths or the theories on contraceptives. I want to ask questions that will debunk some of those myths. I know someone who is taking contraceptives for other medical reasons. So my question is, are contraceptives only for preventing sex, or they are prescribed for other reasons as well?
They are prescribed for other reasons. Now, contraceptives have several benefits, okay? Some are protective against certain cancers, and sometimes we also use them to regulate bleeding and to control certain conditions or the effects of certain conditions like PCOS. So someone may be on a contraceptive pill. You may find a very young lady who is not sexually active on a contraceptive pill. She may be having some abnormal uterine bleeding, and then we are using it to regulate it. Or she may be bleeding a lot that we are using it to stop the bleeding. Okay, so there are several reasons why we will put someone on a contraceptive. That's why you shouldn't be nosy in people's business, and when you see someone taking something, the first time I saw the contraceptive pill was in a mate who was, I think at that time we were about 15 years. But as I've come to know, she was taking it for a very, very, very different reason. Okay, so yes, it has several other benefits, and it's not just to prevent pregnancy. But it's not that you should know that because it has this benefit, I'm taking it. Go and seek appropriate help and then take it.
Okay. Now, a question came in that we're not able to ask. On Monday, we had one doctor come in, and the question came we're not able to ask. Now, the person's question is funny. I was just reading through to remember. The person was asking, or the person was saying that they are very much active when it comes to having sex, but the only problem is that they don't like the feel of the condom, and then the girls they practice these sexual activities with don't also like the feel of the condom, so they are going to practice raw sex till they find somebody who wants to use the condom. Now, the other thing that scared me was the fact that the person says they don't think these girls have the implants. They don't think these girls have it, so they don't really know what happens after the sex. What advice would the doctor give him? Now, fortunately, you are here, so what advice would you give to the person?
Okay. The advice I'll give the person, when you spoke, you said the girls the person is having this with, they do not like the feel of the condoms. He also doesn't like the feel of the condoms. Yes. Okay, so that means that he's not monogamous. He's not having relations with just a single person. How does he know what they have and what he's picking up, what he's carrying? So are you going to have pleasure at the cost of all these risk factors? If it's one person, you understand yourselves, you are faithful to yourselves, you've tested yourselves, you can go ahead and do that. But you're having it with several people, they don't like the feeling, you also don't like the feeling, so you put yourself at risk, carry things that you may regret later. I would advise him not to do that. There are different kinds of condoms, okay? There are some that feel lighter, and there are some that do not feel like anything. Oh, they call feather or something.
Skin.
Ah, great. So we have all those kind of things. So that is not an excuse. I think the person should try, discover more things, and he'll find one that suits him to protect himself. Now, the thing about that, he doesn't know what the ladies are doing to protect themselves against pregnancy. Okay, he'll be there when he's 50 years. They'll bring him a teenager. That's when you were in university, I got pregnant. Aside that, a lot of ladies now protect themselves. They take pills. They do all sorts of things because a lot of them do not want to get pregnant. But you can't be so sure that the lady is protecting herself against pregnancy. So you do your part. You're not ready to be a father, but you're disseminating things all over Accra. No, it's not done.
Right. Okay, so we're going to take 2 final questions, and we wrap up. Ms. Droma, you don't have a question? Okay. Okay.
Hello. Okay, so I wanted to ask, have you ever had sexual assault victims, and how would you handle that situation?
Unfortunately, I have had that. It requires a lot of training because with sexual assault, the person is already in a very distraught emotional state. You have to pick up evidence, send the evidence, or give the evidence to the person to send to the appropriate authorities so that they can make a case and prosecute well. Okay. The cases that I have seen personally have been with children, so we work around this in a very different way. Mothers have to be involved, they have to take their story and all of that. But yes, it's not an entirely pleasant experience. But then I know that Kolibu has a whole unit for sexual assault, especially for children. So if someone has gone through something like that, you can go to Kolibu or you can go to the police hospital where they'll run the tests, the rape kits and all that to make sure that you have the evidence to prosecute appropriately. And after that, I don't know how developed we are with our psychological counseling, but after that, the person has to seek psychological help. Aside testing and making sure that the person doesn't have anything, giving them prophylactic treatment against HIV and other STIs, the person would also have to now actively seek psychological help because it can damage you apart from the physical damage, mentally and socially, spiritually. It's a lot. It's a lot. So it's an unfortunate experience. I hope no one goes through that. Yeah.
Okay.
So I have a question. How do I have an honest conversation with my partner about sex boundaries and contraception?
Sex boundaries, contraception. All right. You and your partner, I believe, some some of these questions, they're above my head. You and your partner have to be on the same plane, okay? If you're both students, you have to understand yourselves. You have to know that with this that we are doing, whatever comes out from it, can we handle it? Can we manage it? All of that. Boundaries. When it comes to things like that, you own your body. I believe if you're talking about partner and all that, you're not even married to the person. Even if you're married, you still own your body. Okay. So if the person is not willing to respect your boundaries, willing to respect what you want, I do not think it is worth it to go forward. Because in the end, what at all are you benefiting from that relationship? Now, the third thing is contraceptives. As a woman, your contraceptive choice is yours. Even with married women, when we are counseling them, we let them know that you can discuss with your partner, but the choice is yours because the ultimate burden is yours. Yes, so the best you can do is to have a discussion, but it's not a decision meeting because the person is not even married to you. Tomorrow, as I said, you go and text your friend and you'll be heartbroken on Snapchat. So the decision for contraceptives is yours. You make the decision and then you can discuss with the person and see what works for both of you. But someone cannot impose it on you. Okay, so I think as a young person, these are the things that you have to think about.
Right. So we're concluding. I hear a few comments came in earlier what the conversation was going on. So,
all right. So most of the comments have been answered, but one that wasn't answered or wasn't related to anything that we had asked was: are female orgasms a myth?
I don't think so. I don't think it's a myth. Physiologically, they exist. Yes. So if a person has not experienced some, I don't know, but physiologically, from textbook, that I know, they exist. So yes, it's not a myth. It's not a myth.
Okay. Do we have any more questions coming in? Okay. Before we conclude, Mr. Joa, do you have anything, any questions, any comments you'd want to leave with us? Can we get Mr. Joa a mic, please?
Yes, I think, thank you very much, Dr. Erica and Tiamwa, for such an insightful session.
Thank you.
And my plea is that for those who were not able to tune in and listen, your friends are here, get to hear from them whatever we were able to grasp in here, because I believe this is a very informative and insightful session. And if we are able to hold on to it and then guide ourselves with it, I believe it will go a long way to help us, because we have these issues happening here on this campus. So don't take them for granted. Let them lead and guide you as to whatever you need to do. And then to answer the question for the last question that came in, yes, so practically, when it comes to female orgasm, it does exist. It's there. When you are ready to get married, and then you have to see somebody for counseling, they are able to teach you how you would be able to help your partner get that orgasm that she might so much desire. But it does exist. Thank you.
So Mr. Joa has made it clear that it does exist, only that it's for married people. Okay, we'll take some wrapping words from Dr. Amanda as well then.
Thank you so much. It's been such an insightful segment. You want me to come in? Okay.
Oh, we have a seat here. I'm sure you do. You want to come sit here? Come to Bias. Yes, clap for Dr. Amanda. She comes. I think we'd have to move. Is that good? Are you okay?
Yeah,
okay.
I'm good. Thank you so much. Thank you so much for honoring our invitation, Dr. Erica, and thank you, Archie. You've always been incredible from Monday to today. We've been having such intellectual questions coming in and conversations, and it's really addressing the issues that we have here as a community. And I'm grateful for the opportunity to have the Health Week. Today is not the last day. Tomorrow we continue, and we are going to talk about drug use, substance use disorders and abuse. And we are going to have highly professional people coming in to the studios again at 9 a.m. to handle that segment for us. And we pray that we have maximum participation, because drug use is a thing of concern for us here in Academic City, and we want to ensure that we have a drug-free campus. So do well to tune in tomorrow. I also want to ask Dr. Erica a question on behalf of the students. We've not talked about toxic relationship in terms of sex. How does a female or a male student navigate their way through a relationship that he or she is being held in or being in a chokehold position as a result of sex? Because people are unable to walk away from abusive relationship because the sex is good. How does someone navigate?
Hey, Amanda.
I'm so sorry.
Okay. First of all, I think that earlier when we were speaking, I spoke about especially young ladies. Sex has a chokehold on you when you are in a relationship with a person. You may not be able to leave, or you may not be able to make right decisions just because of that. And one thing I've come to see is that just advising, like you meet someone, you know that they're in a very toxic relationship, they are staying because of so and so reasons. General advice, till the person is ready to leave, they wouldn't. It doesn't change much. But one thing I've noticed that changes is actually seeing a professional, a psychologist, a counselor. If the person is ready to do it, in psychiatry we call something insight. The person must first have insights that what I'm in is toxic. If they do not have that insight, and I tell you, Amanda, your boyfriend, he's very toxic, you are not going to listen, you're not going to notice. Till I know that this is toxic, I need help, I need to talk to someone. That's the first step. And the second step is trying to get professional help or someone who has experience. Okay. And the third thing is actually trying to leave. And that's the difficult part, because you have so many things holding you down. You spoke about sex, sometimes finances, all of that. Trying to wean yourself off that. It's not a simple process. Some people, it takes them years to be able to do that. But I think ultimately you should not end up, a toxic relationship is better than a toxic marriage. Do not end up in marriage with a person. The first thing is to identify that this is bad. The second thing is to seek help. And with the help, actually trying to free yourself from it. Know that you'll be denying yourself of the comfort, the pleasure, and the things that you are used to having. But the decision to actually want to deny yourself from that, we'll see if you can make progress.
Okay. Now, I also have a follow-up question. Sorry, Dr. Man, before you go. Now, you see, we are talking about toxic relationships. Now, you know, there's a light level to some toxic relationships. Some relationships, the boy is messing around with other girls and all those things. But I'm hoping the people who know what I'm talking about are listening to this. So it's not like I'm putting them on the spot. But there's some type of girls who know their men are sleeping around. And they are not in relationships for money. They have good money, but they know their men are sleeping around. But then from the way he talks to you, from the late night, like all the things, your friends see it, but you don't see it. My friends and I have come to a consensus that it's probably because the sex is good. Because there's no other way they can be in such relationships. Now, in an instance like that, what do you do? If they're in a relationship actively because of how good the sex is, what can we do to get them out of it?
Now, I don't think it's the physicality of the sex, okay? People become very bonded, very attached, very emotionally intertwined. So it's not because of the physical activity of it that, this is very nice. So because of that, I'm staying with the person. It's like breaking up with a person or leaving the person is like losing a family member. It's like someone dying. Can the person cope with that withdrawal? It's the withdrawal of it that the person is like, okay, I know that this person is cheating, but when I try to step away a bit, that feeling that I'm having, I can't cope with it. So you go back to the person. The person needs support, needs people around, and needs to know that whatever breakup you're having, you're not the first, and you would recover from it. So I don't think it's right to simplify it that it's the sex the person is having. But it's the complete emotional attachment and bonding that the person cannot let go of, because it will create such a vacuum in their lives. By this time they eat together, they're always talking on phone, all that. So that vacuum it will create, the person is not ready to let go of that. Okay. Yeah. So
and now to hear from Mr. Joe as well. Before
what Dr. Erica said is very true. And then another important thing is about knowing your worth as a person. Most women or most of our ladies don't know their worth. If you know who you are as a person, you will not you will not settle for less. You will not settle for anything beyond you. So we would have to be able to know our worth, to be able to not stand some of these things that men give to us. Thank you.
And we are so grateful that on Monday we had Dr. Vanessa appear here to tackle knowing your worth as a woman, and she really went in depth with that.
Very much.
And we hope our ladies out there listening really took what she said and are going to put it into practicality. Right. So I think that's a wrap for today's segment.
But you know, you promised yesterday on the show that you were going to teach some of us how to wear the condom on air. So unless you are not somebody who stays by your word, we would expect.
I'm a woman of my word. And as I said yesterday, you can't shame the shameless. Pass me a condom.
Great. So can we get?
So as we wait for the condom, tomorrow we are having a community health outreach right here on Academic City campus, right in front of the clinic. So all students, all staff members do pass by to get checked. We'll be having screenings from hepatitis B, malaria, blood sugar, blood pressures, and BMIs, checking your weight, and also having a public lecture on hepatitis B. Know that some of these diseases are not treatable but are manageable. They do not have cure but can be managed, and knowing how to prevent yourself from coming into contact with these diseases is very important. So do all to come by. We are also going to have a free eye screening on campus. So everybody wearing lenses like myself, like Dr. Erica, if you're having eye problems, please do come by, get your eye checked for free. And we also have a lot of sponsors for tomorrow. And I want to say a big thank you to our sponsors. We have Glyco Health Insurances. They are one of the key insurance provided for our students' body. We also have Kiki Eyewear, who will be coming to do the free eye screening for us. Canary Blue Laboratory Services right across the school. And we also have Just Ask Pharmacy, that is also on the transition stretch. They have affordable medications, and we are going to encourage our students who are giving prescriptions to be buying from them, because they have very quality products, but also affordable products. And one of their leads was here yesterday to talk to us about drug use and antibiotic abuse. And we also have North Legon Hospital is one of our key sponsors, giving us a whole lot of medications. And we want to thank the Women's Commissioner, Marjorie Anda, for also joining us to make ACity Health Week happen and a success. So can my condom come now, please?
Well, I was going to I have a condom here, but you people put me on the spot. So let me. Okay, you can use this condom then.
Okay, so we've been talking about having safe sex and barrier contraceptive practices, and the condom is one of the key barrier practice contraceptives that we have, and it's very easy to access. And I know for a fact that ACT campus, we are, practicing safe sex, because you people, you have vim, you come. And I'm proud of all of you that come to me and say, Auntie, I want condoms. High five to all of you out there. So some of you might not know how to put on condoms, or might not know how to do it properly. You know how to wear the thing, but you don't know how to properly do it. It's not like I know how to properly do it. Obviously, I'm a woman, but we can, go through it a bit.
You need a test subject. You need a test.
Who wants to volunteer?
We can.
Can you help me open it? Maybe we can use a bottle of water to demonstrate.
Okay. Well.
Yeah. I'm so shy, but as a health practitioner, sometimes.
Yeah.
Because I'm not, quite.
I
I wouldn't know how to. I don't even know if this the opening.
He's a virgin.
Yeah. Okay. I think it has an easy tear to
okay,
it.
now is he a virgin?
No, I mean, it's continue the thing.
Technology.
Okay. Okay.
Okay. So when you take
green.
out the condom, see, very colorful. Smells nice. Some of you say we don't like condom, but the flavor also stimulates your brain senses and can help you
Smells
have
like Pepsodent.
very nice sex. You see, and we're talking about hygiene. So if you have a Pepsodent smelling condom, that's a plus. So when you take out the condom, it's already put in a position. I don't remember the last time I had a tuition, but yeah, we'll do. Oh, thank you. This is my boss. So when you take out the condom, you realize that it's already put in a position that kind of shows you where the direction should be. And you have this tip hanging out here. Okay, so don't take the condom and push this side inside. You've turned it inside out. So just as it comes out, you want to, and before you open your condom, kindly practice hand hygiene. Clean your hands so that you do not transfer dirt and microbes onto the condom, because you are going into a very sterile, space of a woman. You are, penetrating the something. So when you take out your condoms, you want to first of all put it on the tip of your male organ or penis. I'm qualified to say penis. So when you put it on the tip of your penis, you want to make sure that it is well, wrapped on the head of your penis so that it does not fall off. I'm happy with the way the paparazzi is going on here. And then when you do that, you hold on to the where the rows are or where the neck is. It's very thick, letting you know that there's a lot of folds of the condom. So it doesn't matter the length, the width, the breadth, and the height.
Wow.
It will fit. Because when I was very young, I kind of, fetched a bucket of water and I poured it into the condom and it was able to accommodate it.
Wow.
So it doesn't matter the size, whether it comes in Chinese pack or Black American pack. We have sizes for everything. So once you put it on, you want to do your hand something like this, and then you would roll. No, the shape of the bottle is unconventional, but I'll try. So when you roll it with your hand, it's supposed to slide freely on the penis. This is so big. We'll try. So yeah, it has tear, but you get the concept. You are supposed to roll it down. You raise your hands. You want to bring it so that we try, or so when you roll it down, the condom is going to slide freely on your penis. Okay, we should use the mic.
Okay, can we get another condom
Another
then?
condom, please.
Yeah. Sorry?
Yeah, well, that's after you've rolled, then you pull the tip a bit to make sure that it's not fully gone. Actually,
Sorry, okay.
This one doesn't have easy tail.
Hey.
Yeah, sometimes be a pro and just,
So you're a pro?
No, I'm not.
When you say be a pro, that means you've gone through the school of taking condoms like that.
I'm shy.
Yeah.
So yeah, you realize that this also has the same situation where the tip is hanging, right?
Mm-hmm.
So you just put it on the head and then make sure everything. So you realize that once you put it on, there's always this small part that is taken out. It won't go to the tip. So some people have the habit of trying to make the whole thing fit, but it's not supposed to be. So you need room, you need allowance to collect the semen that is spilled during ejaculation. So once you put it on, you realize how easy it is to slide the condom on, and then you wear it all the way through, and then you make
But
sure
I thought
that
it
there's
fits all.
enough room.
There's some space left.
This is not the usual length.
Oh, really?
Yes.
Are you sure?
Yes. Thankfully for medicine, we've seen different shapes and sizes during medical procedures.
It's good you're running behind.
I didn't pass a uterine catheter.
I work with women.
So you are supposed to leave some here for room to collect the semen that is spilled. Now, if you do not wear your condom properly, that's when you are going to have some breaking, some tears, and maybe overspilling. Sometimes during intercourse, condom can come off and then get stuck in a woman. So make sure you are fitting your condom properly. Make sure you are considering your partner, and make sure that during the process you are also inspecting that your condom is still on. So by the time you realize, some people, when they are finishing, the thing has come out, and then the semen is spilling. This is some of the reasons why condoms are not 100% safe, because semen can spill and then still have access to the female reproductive tract.
Let's give a big applause to Dr. Amanda. She saved some lives today, and I think it's been a good show. It's been a good show. Thank you guys for coming. Thank you for making time. If you've been listening to us on Facebook and Instagram and YouTube as well, we're very grateful. Everybody listening to us on Zeno, we are really grateful for your time. And we are coming to you same time tomorrow at 9 a.m.
Yes, same time tomorrow at 9 a.m. And we'll be on radio and also right in front of the clinic for the community health outreach. I also want to give a big shout out to our media team. They were here whilst I was trying to sleep. They were sending me messages that we are now leaving, and it was past 10 p.m. Thank you so much for your dedication
Let's
to
clap for
making
them. I
this
think
happen.
they've done.
Thank you so much. And I also want to thank Mr. Nee, our radio man, for also ensuring that we are always on time and have everything that we need. And thank you to our hosts, Seiram, Archibald, Marjorie, Yoline, fake producer, and everybody that made it here today. God bless you and have a nice day.
So before we go off, I think big thank you to Let me start here. Big thank you to Miss Roma for coming, Miss Adjo as well,
Yeah,
my best friend in SCA, Dr. Ben. I love you so much. Spider, who's always at our back when we need him, and also to my father, he's listening now. That's why I didn't say a lot of things today, Daddy. And to my mother, who's listening as well. And thank you to everybody who listened through the links that we shared. We would come tomorrow, same time at 8:30 a.m. And I think it's been a great show. From us here at the ACity Production Studio, it's bye-bye, and catch you tomorrow.
Bye. Condom for everybody, please.
Free condom for everybody. You can take as many.
Except Ise.
Okay, can we? Hold on.
Picture time, please.
Yeah.
They're all moisturizing.
Today we are here to look for talents. And you may ask, what are we looking out for? I know they are students and they don't have all the qualities or skills that we might be looking out for. But what we look out for is someone who is open-minded, a student who is eager, willing, passionate to learn, explore.
It's not my first time in a career fair, but my first time in Academic City University. I had high hopes because we have some of your students currently with us, and information reaching me, they are also going very well. So I was expecting a lot of students, and we could see that the information from them, the sort of questions they're asking, very, very good questions.
It's been an awesome experience. They showed up in their numbers and then they came with more confidence as the day went on. We got the opportunity to speak to a number of students across various year groups. So I can say that we have a number of CVs which we took. We're looking forward to working with them.
The most impressive candidate I've seen today was a master's student from Academic City. She was doing a master's in data analytics and she's built models on cost management, on income prediction. And it was very innovative to see how she was applying what she was learning in school. And because we're also looking at advancing our company and looking at how these models can play an important role in the industry, it was interesting to see that Academic City has slots like that for students to grow and then explore their passion. So that's the most interesting person I came across today.
I think last year we had a couple of them coming into Telecel Ghana. One person I can pinpoint who stood out for me is Christian. I think Christian had to be with us for a while, I think 2 months, for which we had to even ask him to stay on for another month. And 3 things stood out for me with Christian: someone who knows what he really wants in the business. And he's someone who was very committed to the task that is being assigned to him. Not just that, but also he had a hunger to do more stuff in the business. So that stood out for me when it comes to Christian. And I see that more with the Academic City students who happen to be with us, very committed to the task they were doing and very apt to it.
The fair has been engaging and exciting. A key takeaway from this career is that networking is good and making more connections will build a bigger future for you.
My experience at the career fair was very engaging. It was quite fun. So going to the career workshops this semester has really helped. We talked about elevator pitch, how you can communicate and market yourself to these companies. You just have to be yourself. You don't really have to be over sophisticated. Just be yourself. Talk to them about your strengths and weaknesses.
So the job experience I've had at Recomtech has helped me understand that there's always something to learn on the job, because working with the marketing team, the HR team, whilst also providing customer service solutions to other businesses. And so I've understood that even with my career plans, whether I am retained or I find another experience in another company, I know that I'll be able to fulfill any related task I'm given.
Definitely, when we are invited, we'll still come. we still expect more students to come, ask more.
Today we are here to look for talents. And you may ask, what are we looking out for? I know they are students and they don't have all the qualities or skills that we might be looking out for. But what we look out for is someone who is open-minded, a student who is eager, willing, passionate to learn, explore.
It's not my first time in a career fair, but my first time in ACity University. I had high hopes because we have some of your students currently with us, and formation reaching me, they are also going very well. So I was expecting a lot of students, and we could see that the information from them, the sort of questions they're asking, very, very good questions.
It's been an awesome experience. They showed up in their numbers and then they came with more confidence as the day went on. We got the opportunity to speak to a number of students across various year groups. So I can say that we have a number of CVs which we took. We're looking forward to working with them.
The most impressive candidate I've seen today was a master's student from ACity. She was doing a master's in data analytics, and she's built models on cost management, on income prediction, and it was very innovative to see how she was applying what she was learning in school. And because we're also looking at advancing our company and looking at how these models can play an important role in industry, it was interesting to see that ACity has slots like that for students to grow and then explore their passion. So that's the most interesting person I came across today.
I think last year we had a couple of them coming into Telecel Ghana. One person I can pinpoint who stood out for me is Christian. I think Christian had to be with us for a while, I think 2 months, for which we had to even ask him to stay on for another month. And 3 things stood out for me with Christian: someone who knows what he really wants in the business. He's someone who was very committed to the task that is being assigned to him. Not just that, but also he had a hunger to do more stuff in the business. So that stood out for me when it comes to Christian. And I see that more with the ACity students who happen to be with us, very committed to the task they were doing and very apt to it.
The fair has been engaging and exciting. A key takeaway from this career is that networking is good and making more connections will build a bigger future for you.
My experience at the career fair was very engaging. It was quite fun. So going to the career workshops this semester has really helped. We talked about elevator pitch, how you can communicate and market yourself to these companies. You just have to be yourself. You don't really have to be over sophisticated. Just be yourself. Talk to them about your strengths and weaknesses.
So the job experience I've had at Recom Tech has helped me understand that there's always something to learn on the job, because working with the marketing team, the HR team, whilst also providing customer service solutions to other businesses. And so I've understood that even with my career plans, whether I am retained or I find another experience in another company, I know that I'll be able to fulfill any related task I'm given.
Definitely, when we are invited, we'll still come. We still expect more students to come, ask more questions, and also practicality. We want them to also be part of the internship program that we are also organizing.
I think ACity is doing a fabulous job. You know, you are raising like super students, and as I mentioned earlier, we look forward to working with you to include the students into our team.